First of all, it's important to understand what is the opioid epidemic. The opioid epidemic began in the United States in the late 1990s, and this started when prescription opioids such as Oxycontin were increasingly prescribed for pain management. And this was influenced by these pharmaceutical companies providing information to prescribers indicating that the risk for prescription opioids was very low, that it wasn't addictive, and it was a form of getting these prescribers to increase their prescription of these medications. And as a result, this led to a rise of the overall opioid use over subsequent years. If you look at the history of how the opioid epidemic started, it is really defined in three stages, starting with the 1990s when, as I mentioned, the prescription opioids increased, then leading into an increase in the use of heroin. And then now we're seeing the use of synthetic opioids such as fentanyl. And so as a result of this crisis, it has had devastating health and economic and social impacts, which includes, of course, the surge of overdose deaths, unfortunately, and a substantial economic burden. So during the opioid epidemic, state, local, and tribal governments brought several lawsuits against these pharmaceutical companies and drug distribution companies that fueled the crisis. The lawsuits alleged that these companies fueled the opioid crisis by marketing opioids in misleading ways, downplaying the risk, exaggerating the benefits of these opioid medications, and engaging in reckless distribution practices. And the lawsuits seek to recover costs that are associated with the opioid epidemic and remediation. So why is California receiving opioid settlement money? Well, California decided to join several lawsuits against these manufacturers that are responsible for aiding the opioid epidemic. These entities included Walmart, CVS, Walgreens, Janssen Pharmaceuticals, McKesson, and among others. And in the late 2022, these participating subdivisions in California received the first round of funding from these settlements. And these are to be used for opioid abatement activities and remediation, as I mentioned. And as more settlements arise, it is expected that the California subdivisions will receive additional funds. So this is how California opioid settlement funds are being distributed. 85% of the California settlement funds will go to participating subdivisions. So of these 85%, 70% goes into the California Abatement Accounts Fund. These funding is allocated to participating cities and counties. And no less of than 50% of this funding must be used on one or more of the high impact abatement activities that California has set forth. And I will go over those in a minute. And then the other 15% of this 85% goes into the California Subdivision Fund, which is allocated to the cities and counties that were the initial plaintiffs, which are otherwise known as plaintiffs' subdivisions. And then the other 15% of the California settlement funds goes to the state of California. The high impact abatement activities that are set forth by the state include the provision of matching funds or operating costs for SUD facilities with an approved project within the Behavioral Health Continuum Infrastructure Program, creating new or expanded SUD treatment infrastructure, addressing the needs of communities of color and vulnerable populations, including sheltered and unsheltered homeless populations that are disproportionately impacted by substance use disorders, diversion of people with substance use disorders from the justice system into treatment, including by providing training and resources to first and early responders, and implementing best practices for outreach, diversion, and deflection, employability, restorative justice, and harm reduction, interventions to prevent drug addiction to vulnerable youth, and the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. So how are we to use these funds? So all funds received by the participating subdivisions from the California abatement account must be used for future opioid remediation. For the purpose of this funding, the opioid remediation is defined as the care, treatment, and other programs and expenditures designed to address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, or mitigate other alleged effects of, including on those injured as a result of the opioid epidemic. So why is Imperial County receiving this funding? Because, our board decided to participate and join these lawsuits against the pharmaceutical companies. And as a participating subdivision in California, we are now receiving these funds. And Imperial County Behavioral Health Services has been assigned to manage these funds and ensure that treatment and remediation activities are implemented. And to determine how to best address the needs of Imperial County, Behavioral Health decided to request the input from the community. And based on the community's feedback, ICBH has developed an implementation plan that outlines the high impact abatement activities that will be prioritized in the remediation strategies. So what we did as part of this getting the input from the community, we met with different organizations within the county, community members. We sent out emails providing an overview of what we're doing and what the opioid settlement funds were, and providing some history of it. We had meetings and presentations with different committees, and we provided a survey. We also, this survey could have done either in paper form or through a monkey survey. We also provided a QR code that people could log in and be part of the feedback. And so the community survey looked somewhat like this, and we asked that they would rate the different activities based on the level of importance. So the first one was the provision of matching funds or operating costs for the adult residential substance use disorder treatment facility in Imperial County. So as we have presented here, and as you know, Imperial County Behavioral Health was granted through the Behavioral Health Continuum Infrastructure Program about $17.3 million to implement this facility here locally. And we are responsible for a 10% match out of that funding minus the 20% contingencies. So that is about $1.4 million of a match that we need to pay. Because we did use a county-owned land, the value of the land went into portion of that, to the portion of the 10%, and so the remaining balance was our responsibility. So that was one of the uses that we proposed. The other was creating a new substance use disorder outpatient treatment clinic in the city of Raleigh, California, to increase access to care in the northern area of Imperial County. And this was under that high impact abatement activity that asked for either the implementation or expansion of treatment facilities or infrastructure. Address the needs of communities of color and vulnerable populations such as African American, Native American, LGBTQIA+, sheltered and unsheltered homeless population that are disproportionately impacted by substance use disorders. Diversion of people with substance use from the justice system into treatment, including by providing training and resources to first and early responders. Intervention to prevent drug addiction in vulnerable youth, and then the purchase of naloxone and expand the access and distribution. So based on the responses from the community, 30% of those that responded felt that creating a new substance use disorder outpatient treatment clinic in the city of Raleigh to increase access to care in the northern area of Imperial County was a priority. 29% interventions to prevent drug addiction in vulnerable youth. 22% the provision of matching funds or operating costs for the adult residential treatment facility in Imperial County project. 7% address the needs of communities of color and vulnerable populations. 7%, the diversion of people with substance use disorder from the justice system into treatment, and then 5%, the purchase of naloxone for distribution and expansion of and access to naloxone. So as a result of this feedback, we decided to focus on the first three. But because we have encountered barriers with opening an outpatient clinic in the city of Raleigh, at this point we are not able to use funding in that. Therefore, we focused on the interventions to prevent drug addiction in vulnerable youth, and then the provision of the matching funds for the adult residential SUD treatment facility. And this is how it's been currently used. So Imperial County is expected to receive opioid settlement funds for a period of 18 years, starting July 1st, 2022. The amount per fiscal year is unknown because it depends on the settlements that are reached and then the number of subdivisions that are part of the lawsuits. But so far in fiscal year 21-22, we received $261,880 with 49 cents. 22-23, we received $333,989 with 24 cents. And 23-24, $297,862 with 52 cents, with a total received of $893,732,000 with 27 cents. So far, we have used $799,858 to pay for the remainder of the matching funds for the adult residential facility. And we have 93,874 with 27 cents that has been allocated for interventions to prevent drug addiction with vulnerable youth. And we're currently working with the state to present some of the ideas for these interventions. And, they want to ensure that, however we're using this funding in these interventions to prevent drug addiction in vulnerable youth is not being duplicated from other activities that we are currently doing through other funding. So they want to make sure that it's separate from our other alcohol and drug prevention funding, our youth opioid response funding activities. So they have to approve, whatever interventions we implement. And that is it. Any questions?